Go ahead, doctor. What sip do you have in store for us today?
Ah, yes. So the sip for the day. I had shared this sip earlier as well, but I thought it's very important for us to share it again. Yesterday, the 4th of February, was World Cancer Day. It's an important condition that we have to keep in mind. Cancer is something that associates so much of fear, but there is so much that we can do about cancer today. The problem is that we often report to the physician or to the doctor little late, and so that decreases the chances of trying to cure cancer today can be cured. If you have cancer, it can vanish. So many of you are cancer survivors. You had cancer before and had treatment now, and are doing very well. We want everyone to be a cancer survivor, and therefore it's very important that we report to the center, a report to a person who can deal with cancer early, and we need to recognize those danger signs of cancer. I told you about the danger signs of cancer earlier and cautioned you about it, and I told you caution is comes with a loaded message where CAUTION stands for something. C stands for a change in the bowel and bladder habits. So suddenly, if you have a lot of diarrhea, constipation, there is incomplete voiding of urine. Like you could pass urine very well, but now you something kind of remains behind. It's not, you cannot void too well. Incontinence. So change in bowel or bladder habits. Be one concerned about it. One of the concerns could be it could be a sign of cancer. It could be an early sign of cancer. It could be a danger sign of cancer. So C is change in bowel bladder habit. A is anemia. Anemia is less hemoglobin, and that could happen because there could be some kind of a bleeding somewhere, small amount of bleeding they don't realize. So if you are pale, if you look at the eyes, if it's very, very pale, nails, that these are the indication that you could be having anemia, less hemoglobin. Check that, and you need to investigate why are you having less hemoglobin. It's not, there should not be any reason why you should have less hemoglobin. Be eating well, you should not be having low hemoglobin. So anemia could be a sign of a danger sign of cancer. So CAU is an ulcer. So there's a wound that is not healing for long. It could be a sign of skin-related cancer. So you keep that in mind. If there's ulcer that does not heal, T stands for thickness or lump, maybe a thickness or lump in the breast or any other organ. If you find thickness or lumps, get that investigated, get it tested. Don't hide it, don't say it will be nothing, it will go off. You might have to check it first, because if there is something, you can do something about it early. If you delay, cancer tends to, the cells tend to multiply and they tend to spread, and there is metastasis, and then you're dealing with cancer in multiple organs, makes it difficult to treat that kind of cancer. um, I stands for indigestion or difficulty in swallowing. CAUTI, indigestion or difficulty in swallowing. O stands for an obvious change in the size or shape. So suppose you had a mole or you had a wart, and that suddenly starts increasing in size. It could be a sign that there are these cells increasing, and that could be a sign of cancer. Even if you have some lesion in the mouth, and that tends to increase with your tongue, you suddenly feel that there is something inside that seems to be like a lumpy thing, or there is a ulceration that is increasing in size. Get that examined, because these could be danger signs of cancer. So CAUTIO, and the last one is N. N stands for nagging cough. So there's a nagging, hackling kind of a cough that goes on and on. It could be a sign of lung cancer. Bleeding from any side, when you say obvious bleeding from any side, that kind of leads to anemia. That is a sign of cancer. Suppose you cough out and you cough out blood. It is not something very simple. You don't normally cough out blood. So if you need to investigate why that is, could be an infection, all right, or it could be a sign of cancer as well. If you bleed the nose, you bleed through while you're passing stools, it could be red blood, or it could be black color stools. Black color stools, which means the bleed could be higher up, and so it gets the blood, the red blood gets converted to black color, and it comes out. Very tarry type of stools could be a sign that there is a bleed. Bleed does not always mean cancer, but bleed again is something that is serious that needs to be looked into why you're bleeding. So bleeding from any side could be a sign of cancer. So be aware of these signs of cancer. You need to light your candle, and not only stay there lit, but you need to light the candles of others also. So the only way we can reach out to everybody and make sure everyone gets to the physician or to the doctor on time is by making everybody aware of these danger signs of cancer. Okay, so CAUTION. Sometime I will ask you what these are, and you should remember that. I've written a small article. I'll share it on the group so you can read that and revise that. At the same time, I want to caution you that having these signs does not mean there is cancer. Okay, so that's the other problem. There is so much of, I shared this last time, and there's so much of information that is coming on WhatsApp, etc. This scares people. And then you share that information with other people and scare people even more. So just having these signs does not mean that you are having cancer. It just is indication that it could be cancer. Get it examined. If the doctor says it's not cancer, it's something else, can be treated, over and out. Don't keep thinking, no, this is a brain tumor, or I'm having a cancer of my stomach or something like that. Don't think on those lines. Be happy, but be aware, and always keep in mind these SIPs and be cautious. Thank you. That's the SIP for the day.
Thank you, Dr. Amit.